As a practicing physician, I would like to tell you that I'm also very glad to see the strength and the motivation of all of you, because it is probably our last safety net in our practice when we deal with our reality. All topics were talking about resilience. I just learned about the word resilience in the past year and a half maybe, and as I understand it's coping and managing to go through difficult circumstances and succeeding in one's purpose. I don't know if you all agree with that definition, but I think at least it's what I understood in all the meetings that I've been trying to follow today. First topic about building health and resilience in medical school. Well, I'm not too far away from medical school, as you can imagine, but I'm trying to analyze things from my position as also as a teacher with students, and to recognize what has been told in the meeting, in the sessions today. In medical school, there's one big pressure at the end of medical school, at least here in Spain. We face a very important exam that will define our future in our practice. That is the MEAD exam that enables you to enter the specialty program training, and that brings a lot of stress to students, and probably that's one of the main aspects that center students stress during their training. The initiation of contact with the patient and with a new reality is also something that is being pointed out, and also combining that there is an importance in where it has been taught in the workshop just before this event, that there is a great need to help students how to learn to relax, how to learn to combine physical activity, how to build relationships, and how to build a cultural activity around their way through the university. There has also been pointed out that there's a great need for non-technical skills such as ethics and communication skills training, and also that there is a great deal of discussion about the need of having a previous selection of students, defining that selection depending on the grades they had before going into medical school, and the need of social skills to practice medicine during the future. There is a great need for support plans for students. That's also been said in the last session, and also that there is a huge need of change in the curricula in universities that will include those aspects about well-being for doctors. Failure in students who haven't failed is also something that should be mentioned in a world that reality brings them to fail once and again, because none of us will succeed in 100% in our practice. We will all have a situation in which we fail, and we have to face that failure in a way maybe we didn't do that earlier before in our lives. It has also been said that during the practice, the beginning of our practice and our specialty programs, and also during university, students are going away from their environment, from their families, from their friends, and also that they're not working anymore in integrated teams. That there has been a shift into trying to participate in different collaborative teams, and not having one and only reference team that will support you in that way. On the second topic, professionals in resilience in changing healthcare system, I will try to summarize some of the things that have been said, but more or less you will recognize it from the first topic. Education system has to adapt, and there has to be a support system to doctors that will help them find earlier than what now is being available for doctors, that will help them struggle through that psychological health problem, and that health doctors will have healthy patients. Financial agenda is too important. That's one of the things that has been repeatedly said during this last 2 days, but I think everybody will agree that since the financial stress in our systems is conditioning the way we practice and the way we address patient, instead of having the patient in the center of our interest. And stakeholders, nevertheless, are really taking into account physicians' health. The problem is where the money goes and where the help will get from for all the professionals and especially doctors in that stressful environment where the financial agenda is really stressing the system. It is said also in both second and third topic where we're talking about more personal capacity of resilience for professionals, but personal stories and the way they share it are probably more powerful than any other papers that you can publish. The way we try to sensibilize all the population, the medical population, is one of the most important goals of our job. So probably choosing personal stories would be a great deal of help to achieve that goal. I would like to also speak about the third topic. The impact of work is very, there has been many studies about the impact of work, but there's a lack of information on doctors' psychological and relief practice during their own professional practice. Medical practice and medical culture is being dehumanized, and doctors rely on psychologists and not on doctors for their health care. Some messages for the future that they mentioned in the third topic, that the conference that has been suggested for the future is the conference on the fantasy of what doctors gives doctors satisfaction in their practice. And there is a proposal, and I think that will summarize all, and that's what we're trying to do here, is that there should be a benchmark in Europe of work conditions that includes sick leaves, maternity leaves, and things like that. I think what we are trying to do here is share our experience, and what we should try to do in the next steps is build a real network where we can combine our experience and our professionals in terms of helping health professionals to complete the European map, so we can cover all areas in all Europe and help other professionals who are trying to help doctors in the regions, but they don't have as much experience or they don't have the means to give that help. I would like to end this speech short speech in summary. Thanking a lot, the invitation, and thanking all the team behind the work. It seems like I do, but they do. There are many technicians, physicians, and people around me, and that wouldn't be possible, not as nearly possible, without them. The final thank you is to them. Thank you.